Broadcasting Company. Stand by. Stand by.
Dr. Wallace, right away.
Hand in Glove by Stephen Mulrine. Episode 3. Rights and Wrongs. Rights and Wrongs.
Dr. Wallace, how long have you been practicing medicine?
Approximately 25 years.
25 years. Quarter of a century. And in what capacity?
For the past 12 years, Chief Pathologist for Stirling County.
And prior to that?
Resident Pathologist at Stirling Royal Infirmary, concurrent with a period of time as police surgeon.
You've also worked in general practice, I believe.
Yes, 5 or 6 years.
So, you have an extensive knowledge and experience of a number of fields, including the day-to-day practice of medicine. Is there any doubt in your mind concerning the cause of death of the child, Mary Ann Martin?
No.
No? Dr. Wallace, it's my understanding that pathologists in general shun certainty like the plague. And what makes you so certain in this case?
Mary Ann Martin died of diphtheria. The presence of the diphtheria bacillus in the child's throat was easily verified, and in my opinion caused the symptoms which led to her death.
Dr. Wallace, perhaps you could explain in layman's terms something of the nature of the disease.
Of course. The diphtheria bacillus is what is known as site-specific. That is, it remains in the throat or wherever inflammation first occurs and gives out a potent toxin, which circulates in the body. And if the disease is untreated, commonly causes death.
If the disease is untreated, yes. But the disease can be treated, isn't that so?
Indeed. If diphtheria is diagnosed in time, the patient can be inoculated with an antitoxin, which improves their chances quite significantly.
And would such treatment have improved Mary Ann Martin's chances, do you think?
Yes, I'm sure it would.
If her illness had been correctly diagnosed, of course. Dr. Wallace, can you think of any reason why Mary Ann Martin's diphtheria was not correctly diagnosed?
I would rather not speculate.
Let me put the question another way. From the symptoms being exhibited by the child, how might a competent physician have diagnosed diphtheria?
Mary Ann Martin's early symptoms might have been produced by a number of causes. That's very often the case. But diphtheria is also characterized by the formation of a whitish false membrane at the back of the throat. And a simple swab is generally enough to confirm the presence of the diphtheria bacillus.
And you would have taken a throat swab?
Certainly. There's been something of a resurgence of diphtheria in the Stirling area this summer, and it would be an obvious precaution.
An obvious precaution. A simple throat swab. Dr. Wallace, you choose your words with care, but there's surely no denying their implications. Wouldn't any competent physician, any concerned general practitioner have done precisely that?
I would hope so.
And yet Dr. Considine not only failed to diagnose Mary Ann Martin's diphtheria, he appears to have blanked the disease completely from his mind. Despite the fact, as we heard from an earlier witness, that children in Mary Ann Martin's primary school and the surrounding area were, and I quote, dropping like flies. Now, Dr. Wallace, the medicine prescribed for Mary Ann by Dr. Considine, on his own admission, was a simple linctus, a herbal cough syrup. In your professional opinion, what effect would that be likely to have on the progress of the disease?
It might afford some temporary relief of the symptoms, but nothing more than that.
no effect.
No.
Useless. Worse than useless, indeed, since it prevented Mary Ann Martin from receiving proper treatment. Treatment that might have saved her life. Dr. Wallace, are you aware that the dead child's parents are practicing Christian Scientists?
Yes.
And that Christian Scientists are opposed to any form of medical treatment?
I believe that is so.
Dr. Wallace, in your opinion, is it possible that Dr. Considine's so-called misdiagnosis, his hopelessly inadequate response to Mary Ann's plight, might even have had the approval of the child's mother and father? That they might knowingly have allowed her to die to uphold a principle? Is it possible?
I'm sorry. I don't believe I'm permitted to answer that.
Indeed you are not, Dr. Wallace. And Mr. Lorimer ought to know that.
I'm sorry, Your Honour. Perhaps if I rephrase the question?
You may save your breath, Mr. Lorimer. And I find your choice of words quite extraordinary. Approval, indeed.
Well, thank you, Dr. Wallace. You may stand up.
I just can't imagine any mother letting that happen.
Well, it's not the worst I've experienced.
I mean, a normal, loving mother. It's almost inconceivable.
That's what the jury think. You could see it on their faces when she was being discussed. They think she suffered enough, and that might save Considine as well.
You say they're Christian Scientists. I thought they didn't bother with doctors.
Not as far as I know they don't. And that's something that puzzles me.
You mean that this Dr. Considine was called in at all?
Aye. Well, there have been a few cases not unlike this, but it's usually the parents in the dock, for obvious reasons. Apparently, it was Mrs. Martin's mother that reported it, and the defence are making an issue out of her dislike for her daughter's husband. Juries might not know much about Christian Science, but they know mothers-in-law.
Maybe they should try seeing her as a grandmother. Have the Martins any other children?
They've another 3, I think, all under the age of 7. This is part of the defence case as well. The other children have had just about everything that's going. Mumps, croup, whooping cough.
Oh, no.
And they've recovered without any help from the medical profession. Thanks very much.
God help the wee souls.
But that's just the point. That's what they believe.
So who called Considine in?
I don't know. Possibly the mother, Mrs. Martin.
Really?
Breaking ranks with the faithful. Yes. It's a puzzle.
And you're in court again tomorrow?
Well, I think the medical testimony's over, unless the defence want to have a go. Their own expert managed to blind the jury with non-science, I gather.
As distinct from nonsense?
Same thing. According to Dr. McAllister, diagnosis is a bit like pinning the tail on a donkey. So, the jury now think Considine was just unlucky. Anyway, you've got enough on your plate tomorrow.
Oh, God.
First day at the GRI.
Oh, I've been trying to talk her into an early night, so she'll be well rested. But it's a waste of time.
I wouldn't be able to sleep anyway. I'm too excited.
In some ways, it's a pity you've got to travel through to Glasgow. But Randolph's a first-rate clinician. He'll give you a hard time. His students are terrified of him, but he's worth listening to.
Well, as long as he's fair. I can't ask more than that. The Edinburgh Royal hasn't changed since Professor Archer's time. They still don't want women on the wards, unless they're nurses.
Oh, Randolph has his prejudices as well. Doesn't like surgeons. Oh, I've heard he tells students all they need for surgery is to be a good dressmaker.
Really? There's more than one prejudice lurking in there. Anyway, Mary Ibbotson recommended him, and I think it was probably her letter too that got me accepted. I just hope I don't let her down.
I'm sure you won't. Though I must say I'm relieved you're out of that clinic. She couldn't have picked a worse part of Edinburgh, frankly.
Mum, that's the whole point. Oh, didn't somebody just say that? Anyway, the Royal Infirmary is not exactly in a garden suburb, you know. And I'll have to walk to Buchanan Street Station, maybe even in the dark.
Oh, well, I'm sure you'll find some nice young man to escort you.
Oh, never misses a trick, does she?
Mrs. Telfer, counsel for the panel has suggested that your motive in reporting this matter to the police had nothing to do with your concern for your grandchild and everything
Grandchildren.
I'm sorry?
Grandchildren. There's 3 ways still in that house.
Yes, of course. Mrs. Telfer, it's been suggested that you were motivated by hatred of your son-in-law. Now, is that true? Do you hate John Martin?
After what happened to Mary Ann? Yes, I do. God forgive me.
But before that, what was your relationship with your son-in-law?
I didn't like him. I've never liked him.
Why not?
Because of what he's done to my Ruth. My daughter's got no life.
No life, Mrs. Telfer. Now, perhaps you could explain what you mean by that.
He's drained the life out of her. She's got no mind of her own, no spirit.
Mrs. Telfer, there are a number of people, some of them in this court, who would say that your daughter had no spirit until she met John Martin. That until she embraced his Christian Science beliefs, her soul was dead within her. What would you say to that?
Oh, I'd ask them what kind of spirit it takes to watch your own child suffering and do nothing. What kind of mother could do that?
And Mary Ann wasn't the first of your grandchildren to suffer in this way, was she?
No, we, John and Sarah, have had mumps, both of them. And Mary Ann had whooping cough at the beginning of the year.
And did they receive any medical attention?
No, not a damn thing.
Mrs. Telfer.
I'm sorry, Your Honour.
Whooping cough and mumps. Now, these can be very painful and distressing. You're sure that's what the children had?
I brought up 6 of my own. They had everything under the sun. And the doctor to attend them. I know what I'm talking about.
But as the counsel for the panel pointed out, your grandchildren recovered from these illnesses and are none the worse for it. Your daughter and son-in-law would presumably say it was God's will, that God granted them the strength to overcome the disease.
Oh, aye. They'd say that, all right. All that laying on of hands and praying. Oh, it's got to do some good, hasn't it? Well, I never saw it. All the time those Waynes suffered. The whooping cough nearly finished Mary Ann in January. She was always delicate. And when she took ill again, I knew it was diphtheria. No matter what that damn quack said.
Mrs. Telfer, kindly moderate your language.
I'm sorry, Your Honour.
Well, Mrs. Telfer, I take it you were referring in that last remark to the panel, Dr. Considine. I'm not sure I understand why he was called to attend Mary Ann in the first place if your daughter and son-in-law didn't believe in doctors.
Oh, don't ask me what they believe. All I know is, I told Ruth, Mary Ann had diphtheria, and if she didn't want the Wayne to die, she'd need to get a doctor, and never mind what he said.
He being your son-in-law, John Martin.
Ah, that's right.
And did she agree?
Oh, she did. She was hysterical. She knew herself how close Mary Ann had been with the whooping cough. Mothers know these things.
So how did she come to call in Dr. Considine?
She didn't. It was him that called Considine in.
Your daughter told her husband?
She told him if he didn't agree to a doctor this time, she was leaving him.
That took some courage, I would imagine.
She was desperate. And somewhere there was a shred of spirit left in her. A bit of the daughter I gave birth to. It didn't do any good, though. Not with him. Not with that damned charlatan.
Mrs. Telfer.
Well, it's the truth. He's not fit to dress cats. He should have been allowed near that poor wee soul.
Mrs. Telfer, you've had your last warning.
Her mornings are time.
Mr. Lorimer, you can stand down your way.
Yes, well, you
And I'll
can.
adjourn this hearing until 10 o'clock tomorrow.
Right, gentlemen, and Miss Wallace, of course. I think you've had enough time now. Abdominal pain, acute constipation, jaundiced appearance. Mr. Pritchard, what have you gleaned from the patient? How did you find him?
I'm sorry?
Turned back the sheet and there he was, I suppose. I mean, what sort of mood was he in? How did he react to all your prodding and poking?
Not too well, sir.
Bit uncooperative? Yes, I should think he was. You should remember you're pressing tender organs, not palpating melons. I understand you want to be a surgeon, Mr. Pritchard.
Yes, sir.
Just as well. At least your patients will be anaesthetised. Mr. McDade, can you shed any light here?
Well, sir, the patient's appetite's very poor, he says, and the abdomen's quite rigid. He's been suffering from headaches and a general soreness in the joints. And he said he'd been getting tired very easily at work. Oh, and a sort of metallic taste in his mouth.
You seem to have squeezed a bit more out of him. You might tell Mr. Pritchard your secret.
I said I'd try and smuggle him in a beer.
Resourceful enough, if unethical. Mr. O'Donnell, the next move?
Well, sir, I think I'd want urine and stool samples. See what's going on internally.
All right. And if I tell you that the patient is passing blood, and there's also protein in the urine, some granular casts, increased platelets, reticulocytes about twice the normal percentage, what would you say? You'd say he's pretty sick, wouldn't you? Did anyone notice a slight tremor? Mr. McDade, maybe it was in anticipation of that beer of yours. Mr. O'Donnell, anything to add?
I think I'd want an X-ray of the abdomen, sir.
Oh, really? All that soft tissue? Now, why would you do that? A shot in the dark. You're not wrong, Mr. O'Donnell, but it does help if you have even a ghost of an idea of what you're looking for. Anybody? Miss Wallace, last but not least, what might Mr. O'Donnell be looking for on his X-ray picture?
Lead?
Yes. That's absolutely right. Radiopaque particles of lead. Tell me, Miss Wallace, did you examine the patient's gums?
No, sir, I wasn't able to.
Kept his teeth clamped shut, yes, I know. But what would you expect to find?
Well, lead lines, possibly. A brownish line along the gums.
Indeed. Have you ever seen it?
No, sir.
But you read a lot, eh? So tell me, Miss Wallace, what made you think of lead?
Well, he is a painter by trade, so...
You asked him what he did for a living?
Well, yes, sir. He works in the paint shop at John Brown's. Or at least he did. He's worked there the past 12 years on all the big ships, so he says.
Well, Miss Wallace. Miss Wallace, your diagnosis is absolutely spot on. Painter's colic, as it's vulgarly termed. Makes it sound like teething troubles, Chronic lead poisoning. Well done, Miss Wallace. And take note, the rest of you. Talk to your patient. Listen to what he's got to say. And that was a dismal showing, Mr. Pritchard. I expect better from my students, even if they do want to be dressmakers.
Aye, well, some of us have got a head start. Hey, O'Donnell, where are you going? Oh, good God, man, we're not sitting with her, little Miss Smarty Pants.
You're wasting your time anyway. She's already got her book out.
Aye, reads a lot, that's right.
Oh, cut it out.
It'll be Gleister's toxicology. Watch out she doesn't poison you.
Paddy, there's a table up the back. Are you coming?
Suit yourselves. Hi. Mind if I sit here?
It's a free country, so they say.
Thanks. Carry on reading if you want. The name's Patrick, by the way. My God, that is Gleister you're reading, isn't it? Should I have ordered an emetic?
Oh, I'm sorry. The name's Barbara.
Oh, I know. Father, the distinguished pathologist and all that. Your fame's run ahead of you.
Is that so?
I think that's partly why those two are so... Well, you know what I mean.
He said partly. Well, what does that mean? What's the other part?
Well, you were showing off a wee bit.
Rubbish. How was I showing off?
Maybe not showing off. But you look pleased with yourself.
Oh, damn it, of course I was. Who wouldn't be? It's because I'm a woman, isn't it? I'm expected to apologise for being right. Well, I got here under my own steam. I've had to endure enough prejudice, and I'm apologising to nobody. Maybe you should join your chums.
I'm sorry. Look, I know how you feel.
Do you? I don't see you wearing a skirt.
You think I don't know about prejudice? You know how long it took me to get into the medical faculty? Try being the son of a bog Irish immigrant whose ancestors haven't been doctors back to the time of Galen.
Could be worse.
You think so?
He could have been his daughter.
Isn't it the case, Mr. Martin, that your wife has refused to speak on Dr. Considine's behalf? That she will no longer support you in this cause?
My wife, a sick woman.
Yes, she has lost a child. I would imagine so. She must be suffering very badly. As your daughter, Mary Ann, also suffered. Mr. Martin, I think we would all recognise a distinction between pain which can be relieved and that which cannot. Your wife's pain, unfortunately, is of the latter kind, but your daughter's was of the former. Mary Ann could have been relieved of her pain had her illness been correctly diagnosed. Would you accept that?
May I be allowed to speak?
Go on.
Mr. Lorimer, I don't accept your views on suffering in the first place. You don't understand our beliefs. We don't make any distinction between these things, not in the way you suggest. Christian Scientists believe that all human suffering, whatever its nature, comes from our blindness to the reality of Christ's love. Diagnosis is irrelevant because the true sickness is spiritual, not physical. It's caused by our mortal mind, which, as St. Paul says, is enmity against God.
Mr. Martin, when I permitted you to speak, I did not license the sermon. Make your point, sir, whatever it is.
Your Honour, if I can put it another way, to talk about suffering as we see it is like sitting in a room with the blinds drawn, discussing the nature of darkness, when what's really needed is to let in the light. As the prophet Isaiah said, the people that walked in darkness have seen a great light. They that dwell in the land of the shadow of death, upon them hath the light shined.
Mr. Martin, that will do. Mr. Lorimer, have you any further questions for this witness?
Mr. Martin, it's my understanding that Christian Science believers like yourself have no time for the medical profession. That you have your own so-called healers who claim to be able to cure everything from TB to a broken leg.
No, that's not true. First of all, we don't make any such claim.
Oh, indeed you do, sir. I have here in my hand one of your pamphlets, printed here in Stirling, which is a virtual catalogue of miracle cures.
We do no more than follow Christ's own example when he healed the leper or the man stricken with palsy.
Really? And on whose authority?
None higher. You should read your Bible, sir. St. John's Gospel, chapter 14, verse 12. He that believeth on me, the works that I do, shall he do also. Matthew 16, verse 18. They shall lay hands on the sick, and they shall recover.
Lorimer, I think I'd advise another line of questioning. This is a rather one-sided contest.
Thank you, Your Honour. Mr. Martin, I don't think there's any doubt about your faith. If I can dip my toe in your waters, so to speak, a faith that can move mountains.
Remove.
I'm sorry?
The word is remove. 1 Corinthians chapter 13.
I stand corrected. But, Mr. Martin, what I want to know is why a devout Christian Scientist holding the views you have expressed in this court should have called Dr. Considine in the first place. Or perhaps last resort, if you prefer. Isn't it the case that your miraculous healing powers were having no effect whatsoever? That your faith was demonstrably failing to ease your daughter's suffering?
Christian Science has no claim to be infallible. We have our failures. So too has the medical profession.
Indeed, Mr. Martin, that is the tragedy of this case. One might say that your child, Mary Ann, was failed twice. But, to return to my question, why, given the beliefs you hold, should you have sought help from a medical practitioner? What made you go against your own deepest convictions?
Mr. Lorimer, are you a married man? No? Then I'm sure the witness can furnish you with another verse from his Bible. No doubt the one about a brawling woman in a wide house.
Your Honour, may I remind the court that the real issue here is the needless death of a child.
sort of special, Mum. Dr. Ibbotson more or less insisted she'd stand me a dinner after my first day. I'm hardly worth a button, to be honest, but I can't let her down. She said she'd book us a table at the Ambassador Hotel. I'll likely fall asleep after this soup.
Soup? Oh, nothing so common. Vichyssoise at the very least.
Barbara, you're not going anywhere like that, surely.
Mum, I'm meeting a woman friend for dinner. I'm not trying to impress some Edinburgh solicitor.
It's the waiter you've got to impress in these places. Didn't anybody ever tell you?
No, I've had a deprived childhood. Listen, Dad, you couldn't possibly...
Give you a lift to the station before I sit down, hungry and exhausted to my frugal meal.
Yeah, less of the frugal. Oh, I'll tell Mrs. Hamilton on you.
What would you do if I said no?
How's your technique with slashed wrists?
Barbara.
No, he made mincemeat out of Lorimer, I'm afraid, and you could almost feel the whole court coming round to his side, including the sheriff. It's an awe-inspiring sight, fanaticism. Normal people are riddled with doubt as a rule, so when somebody claims to be absolutely certain, well, it's got great pulling power.
Are you going to be in court for Considine?
I don't think so. Technically, I'm not supposed to hear the other medical evidence in the interests of impartiality. I might be recalled before that, of course. Frankly, I think the case is running away from the Crown, and the defence haven't even needed to bring in Mrs. Martin, the grieving mother.
Oh, maybe they don't dare.
You could be right.
Anyway, Dad, thanks a million for the lift. I'll just make it, I think.
Have a good time, Barbara. And don't thank the waiters. They'll only despise you.
Bye, Dad. Don't wake up.
Well, I make that now 25 minutes and not so much as a menu. Do you think the fellow with the napkin over his arm's catatonic? He's looking in our direction. At least he's facing our way. But he's not moved a muscle since we sat down.
Well, they did show us to our table. They know we're here.
God, Barbara, I'm starving. I skipped lunch so I could really make a pig of myself. Well, you must be hungry too.
I had a sandwich at the GRI, I think, but it seems so long ago I can hardly remember.
Small wonder, after your stunning performance for Dr. Randall.
Oh, God. That's just what it was, a performance. Honestly, Mary, I should have known better.
Rubbish! Why the hell shouldn't you shine if there's an opportunity? This is a career, not just a vocation, you know.
Yes, I know, but still, even
I suppose you're right. But don't let it worry you. It's Randolph's good opinion you need, not those Neanderthals. Oh, for heaven's sake, this is ridiculous. Watch me make a spectacle of myself. Oh my goodness, look what I've done.
Mary.
I'm so clumsy. Oh, this is so embarrassing.
That's all right, madam. No harm done. I'll just clear this up.
Oh, thank you. By the way, do you think we could have a look at the menu while you're doing that?
Wasn't this table reserved by a Dr. Ibbotson? You wouldn't rather wait, madam?
No, I think we'd rather eat now, if you don't mind. If the doctor has to wait any longer, she'll be eating the candle wax.
I beg your pardon?
I'm Dr. Ibbotson.
Oh, I see. And you wish to order now?
That's correct.
I do apologise, madam. You're not being joined by anyone later?
No, we're not. The table was reserved for two, I think.
I'll bring you a menu immediately.
And I have my own bank book, so I can even buy my own dinner. God, that's priceless, isn't it?
I don't think he believes us yet.
No, the real Dr. Ibbotson will appear at the door any second in comfortable tweeds, as they say,
Mary.
and start shouting, "Imposter!"
You know, the last thing my dad said when he dropped me at the station was, "Don't thank the waiter, he'll only despise you."
I know. It's that damned inverted snobbery thing. It's so British.
I know.
What's your father working on now, incidentally?
A malpractice suit, oddly enough. Oh, it's actually quite tragic. A Christian Science family in Stirling. A daughter, about 4, with diphtheria. She died after a wrong diagnosis, and I think the grandmothers brought the action. I didn't think they had any dealings with doctors, but seemingly in this case they did, and he missed it.
Diphtheria? It's not something you can miss, is it? They do consult doctors now and again, you know. Or I suppose the more open-minded ones. I once had to set a broken wrist for a Christian Science patient, a teenage girl. That wasn't treatment, though. That was what they call a mechanical adjustment.
Really? Well, I suppose if it had been anything more serious, they'd have let her get on with it.
Well, they do make extraordinary claims.
So Dad was saying. The prosecution passed some of the literature out in court, but it didn't produce the desired effect. The jury were supposed to laugh, but he reckons most of them sat there goggle-eyed.
I can believe that. But they called in a GP in this instance. So, who was he?
A Dr. Considine. I don't think he practices in Stirling. Do you know of him?
No, not in Edinburgh either. At least not to my knowledge. Mind you, that's confined to a square mile or two. There was a Considine in Dublin when I was there. It rings a bell, but I can't remember why. God.
Madam?
Thank you.
This evening's special is Truite aux amandes with pomme dauphinoise and haricot vert.
Thank you. And can we have the wine list, please?
The wine list? Certainly, madam.
And some bread? To gnaw, please, while we're waiting.
Of course.
He's not too happy about the wine list, is he? Probably thinks we'll do something disgraceful.
Well, I'd hate to disappoint him. How do you think a wee dance on the table would go down? Good God, Barbara. There's at least 50 pairs of eyes on us. Do you realise we're the only unaccompanied women in this place? What are you going to have? How about the tweet?
Mary, don't. You're making me laugh.
Well, I'm going to order the steak Chateaubriand with an extra serving of mushrooms. I might not eat it all, but I want to see the look on his face. God, I really hate all that ladies' portion stuff, especially when I'm hungry.
Am I allowed the whole roast ox?
What? Where did it say that? God, Barbara, we're getting silly and the wine's not even arrived yet.
Dr. Considine, I'm aware the court will be already familiar with this, having listened to the testimony of other medical witnesses, but perhaps you would refresh our memory and describe for us the initial symptoms of diphtheria.
Diphtheria?
Yes, Dr. Considine, in layman's terms, of course.
Well, initially, a feeling of general malaise, loss of appetite, headache, feverishness, rapidly followed by sore throat, inflammation of the larynx, difficulty in swallowing, spasmodic coughing.
Go on, Dr. Considine.
You asked for the initial symptoms, sir. That's what I have described. These are also the early indications of croup, whooping cough.
Dr. Considine, the question concerns diphtheria. Now, among the symptoms of diphtheria specifically, wouldn't you expect to find what one standard textbook describes as morbid changes on the mucous membrane?
Perhaps.
Meaning what, Dr. Considine?
Meaning diagnosis can be extremely difficult. It depends on the circumstances.
What circumstances, for example?
Well, not every household has electric light or coins for the gas meter.
Are you saying that you were unable to examine Mary Ann Martin's throat properly because of insufficient light?
No, sir. You asked for an example of difficult circumstances.
Mr. Lorimer, is there a point to all of this? If there is, I'd be obliged if you could come to it.
No. Dr. Considine, on the evidence, it's clear that not only did you fail to diagnose Mary Ann Martin's illness and thus effectively contribute to her death, but you also failed even to consider diphtheria a possibility, despite the fact the disease was known to be rife in the area. Now, what have you to say to that?
Sir, on the latter point, I have fairly recently arrived in Stirling. I have yet to establish a practice, and
while I don't offer it as an excuse, I was not aware of any local epidemic. I might add that physicians can also make mistakes by jumping to conclusions based on what seems to be prevalent. And on your first point, yes, I may have erred. Which of us hasn't? If every doctor who had made a mistaken diagnosis were to be brought into court, the streets would be full of thieves and murderers going unpunished.
Well said, sir. First bit of sense I've heard all day. Mr. Lorimer, I'll permit you one more question before we adjourn until tomorrow.
Your Honour. Dr. Considine, are you a member of the Christian Science movement?
No, sir. A victim, if you like.
Mrs. Hamilton, don't make any breakfast for me, please. I'm running late as it is.
No wonder. What earth time did you get home last night?
Oh, don't ask. There isn't a bottle of aspirin in here, is there?
In a doctor's house.
Oh, you'll have a piece of toast.
Oh. Now, you can't go out on an empty stomach. Your mother's in the dining room. There's coffee just put out.
Thanks, Mrs. Hamilton, but I daren't miss that train.
Telephone.
Oh, no. Mum, are you sure it's for me?
Yes, dear, it's Dr. Ibbotson.
Mary? Oh, God, like death warmed up. Oh, yes, wonderful. Listen, Mary, I've really got to dash or I'll miss my train. What? Oh, you're not serious? In Dublin, honestly? Oh, God, yes, put it in the post, please. No, wait. He'll say it's unethical or something, I'm sure he will. What about the solicitor? Let me think. Oh, my mind's gone blank. I'll never touch another drop. Lorimer? I've got it, yes, that's his name. Lorimer. Oh, Mary, I haven't a clue. Well, I don't think it'll be sterling. Yes, it could be. I don't know how you check these things.
Now, gentlemen, you will have observed the patient's pulse, which is clearly abnormal. Mr. Pritchard, perhaps you can describe it for us?
It's very extreme, exaggerated. A sudden kind of surge, and then
up 1 minute, down the next.
Yes, sir.
It's a pity your observation isn't matched by your powers of expression, Mr. Pritchard. Mr. O'Donnell, perhaps you can furnish us with a more professional description? Do remember, gentlemen, that you're entering a profession, and a very significant proportion of your status will derive from your mastery of professional language. Inaccessible to ordinary mortals, of course. Mr. O'Donnell, how would you describe this patient's pulse?
Well, sir, there's a very sharp rise to full expansion, and that's followed by immediate collapse.
Yes, that's much better. Like a steam hammer, Mr. Pritchard, wouldn't you say?
Yes, sir.
It's known as Corrigan's pulse. Make a note of it, Mr. Pritchard, along with the word collapse. And no doubt some clinician will be standing here in a few years' time describing Pritchard's dysphasia. Corrigan's pulse, gentlemen, symptomatic of aortic incompetence or insufficiency, and a clear indication of what? Mr. McDade? Come on.
Corrigan's disease.
Brilliant! Yes, Corrigan's disease. Much to Mr. McDade's astonishment, he's got it right. Mr. O'Donnell, what can you tell us about Corrigan's disease?
It's a form of aortic regurgitation.
Yeah, that's good. Go on.
Well, sir, it's when the blood leaks from the aorta back into the left ventricle during diastole. It's caused by the aortic valve not closing properly.
Yes, exactly. Well done, Mr. O'Donnell. A sound, professional answer.
Dr. Randolph, I'm terribly sorry. I missed my train this morning. It won't happen again, I promise. I had a very urgent
Miss Wallace, I don't want to hear any excuses. Your tardiness could mean life or death to a patient. And as far as I'm concerned, it's even worse than that. Failure to be in place when I start my round is the sin against the Holy Ghost, which not even God can forgive. It's unprofessional, Miss Wallace. Take the rest of the day off. Catch up on your reading. You may join us tomorrow morning if you're on time. Now, Mr. O'Donnell, Corrigan's disease. What can you tell us about the likely prognosis?
Dr. Wallace, to return briefly to the issue of fatally wrong diagnosis, which is at the heart of this case, can you think of any reason, apart from incompetence, why Dr. Considine might have neglected to examine Mary Ann Martin specifically for diphtheria?
No.
Are you quite certain?
Mr. Lorimer, I doubt if even Dr. Wallace can read a fellow practitioner's mind. Come to the point, please.
Sorry, Your Honour. Dr. Wallace, in the evidence you gave to this court earlier, you described the administration of an antitoxin, which I believe is nowadays standard practice.
That's correct.
Is it an effective remedy for diphtheria?
It is, yes.
How effective exactly?
Well, there have been no clinical trials to my knowledge, but...
And why is that?
I couldn't say with any authority, but a clinical trial of any new drug, say, would normally entail withholding it from a control group of sufferers.
Allowing them to die, presumably, to prove a point.
That's one way of putting it.
Mr. Lorimer, will you kindly permit your witness to answer the question you've asked him? Continue, Dr. Wallace, please.
Well, there are no reliable statistics for the reason I've given, but deaths from diphtheria have declined very sharply since the antitoxin treatment was introduced at the end of last century. If I can perhaps draw a parallel where statistics are available, anti-tetanus serum, which functions in much the same way, was first widely used during the Great War, where it reduced mortality from tetanus-infected wounds from a figure of 30 deaths per thousand to virtually none.
And you would agree that diphtheria antitoxin has had almost equally dramatic results?
Yes, I believe so.
And Dr. Wallace, would you tell the court how that antitoxin, which has saved the lives of many hundreds, perhaps thousands of people, is manufactured?
Yes. It's prepared by injecting a horse with the diphtheria bacillus in increasing doses to render the horse immune. The anti-tetanus serum is incidentally produced by the same method. At any rate, the horse's blood, which is then antitoxic, is drawn off, allowed to coagulate, and the serum is filtered out.
And this serum, the antitoxin you've described, is then routinely administered to human beings, children, such as Mary Ann Martin, suffering from diphtheria.
That is correct.
Thank you. Your Honour, I would like to introduce as evidence a pamphlet which I received only this morning, but which I think has a direct bearing on this case.
I should hope it has, Mr. Lorimer. I should also hope it is not another recital of miracle cures or biblical quotations.
No, Your Honour. It is a pamphlet printed in Dublin some 3 years ago. A polemic, one could only describe it as virulent, against vivisection and indeed any use whatsoever of animals in medicine. The arguments, such as they are familiar, and I don't intend to waste the court's time with lengthy quotation.
For this relief, much thanks, Mr. Lorimer.
I will, Your Honour, however, draw the court's attention to the fact that both diphtheria and tetanus antitoxins come under violent attack on account of the pain allegedly inflicted on horses during their preparation and their unnatural character. The author of this pamphlet, named on the back page, is one Dr. Eugene Considine.
Oh!
Hi. Mind if I join you?
You needn't bother. I'm just about to go. I hope you didn't get that from me.
No, of course not. I always buy 2 cups of coffee. I like drinking the second one cold. come on, cheer up. It's not the end of the world.
That's original.
Oh, look, you're not going to make me sit here smiling with 2 coffees and 2 fly cemeteries. People will think I've been stood up.
So, you'll just be embarrassed.
That was awful this morning.
Some people enjoyed it. I think it's called Schadenfreude.
Sorry, I didn't do French.
It means taking a perverse delight in other people's... Oh, God. I fell right into that. Showing off again.
Listen, you don't want to let those 2 bother you. If you'd heard what Pritchard had to take before you arrived. Randolph even invented a new syndrome for him. Pritchard's dysphasia.
Oh, well, he deserves it.
Oh, come on, Barbara. He's just a wee bit slow. Same as you were just a wee bit late. You're not looking your best, actually. A late night?
Whatever happened to gallantry?
Sorry. Here, do you take sugar?
Thanks. No sugar.
Was it a late night?
Inquisitive, aren't you? Well, yes, it was, as a matter of fact. Someone I'd been working with in Edinburgh, Dr. Ibbotson, took me to dinner at the Ambassador Hotel. Do you know it?
Are you kidding? What, is he a consultant or something?
Runs a mother and child clinic in the city centre.
I see. It'll be like printing your own money, that, I suppose. Well, no wonder you were late. I'm surprised you came in at all. Did he give you a lift?
If you must know, he's a she. It's Dr. Mary Ibbotson, and the clinic's in Jeffrey Street. You can draw your own conclusions about the patients and the money.
Really? And you worked there?
I did. I had a couple of months' residency, mainly obstetrics, some novice midwifery.
My God, you'd have seen life in the raw there. I am impressed.
What? Did you think I spent all my time in the library?
You have got a sore head, haven't you?
I'm sorry. I didn't get much sleep. I'd probably missed the train anyway, but I had a phone call just as I was rushing out the door.
Well, it's a natural law, isn't it? That, and when you just stepped into the bar?
I couldn't ignore it. It was Dr. Ibbotson. My father's in Stirlingshire of Court this week. One of those cases where the parents refuse medical treatment for a child on religious grounds.
God, I don't envy him.
Well, this is even more of a hornet's nest. There's a malpractice charge come out of it, and she phoned with a really important bit of information.
So you couldn't exactly hang up on her?
Oh, indeed, no. I wouldn't do that anyway. Not after she paid for my crêpe Suzette flambé.
Sublime, eh? Here, try the ridiculous.
Fly cemetery?
I'll call it a fruit slice, if you insist. Oh, no.
What's the matter?
It's those 2.
Well, look who it is. You don't give up, do you, Paddy?
Hey, Paddy, are you sure that's wise?
It'd be too much to hope they could keep their mouth shut, wouldn't it?
Look, I'd better go. I should have gone straight home anyway.
Oh, whisper.
It's a conspiracy.
You'd better watch it, Paddy. These women are only after one thing.
Aye, a husband, so they can quit work. She'll never last a pace.
What, are you giving up already, Bab?
Right, bye. Thanks for the coffee.
Barbara, don't let them... Barbara!
Dr. Considine, you gave evidence earlier to the effect that you were not in any way connected with the Christian Science movement. That you were a simple general practitioner whose presence in this court is the result of nothing more sinister than accident, human error, such as we all at one time or another commit.
Mr. Lorimer, I have asked you to be brief. Put your question, please, without preamble.
Your Honour, I feel it is necessary to remind the court under which flag Dr. Considine has been sailing, so that we may be better able to assess his culpability in this tragic business.
Flags? Sailing? Get on with it.
Your Honour, Dr. Considine, do you recognise this pamphlet?
Yes.
Is this your writing? You are responsible for the content of this pamphlet. It bears your name.
Then I suppose I must be.
Printed and presumably circulated in Dublin 3 years ago. Would you agree, Dr. Considine, that this is a polemic, employing at times some violence of expression against the use of animals in medicine, including the manufacture of diphtheria antitoxin?
I'm not sure I understand.
Understand what, Dr. Considine? It is a polemic, surely?
I know what a polemic is, sir. I don't know what you mean by violence of expression.
Dr. Considine, that is a red herring. The point is that
Mr. Lorimer, the panel has a right to ask for clarification.
Your Honour, I had no wish to engage in further lengthy quotation. The point is simple enough.
Your Honour, may I be permitted to speak?
You may, Doctor, but please no flags or red herrings.
Your Honour, I am being asked to defend my writings on an issue which I will admit concerns me deeply, but which has no direct bearing on this case.
Dr. Considine, that is for me to decide. I have already allowed this pamphlet to be produced in evidence, if that's all you have to say.
Your Honour, I have a simple request to make. Mr. Lorimer has characterized my language as violent. He is entitled to his opinion, of course. One man's violence is another man's righteous anger. However, the implication, whether he intends it or not, is that I am a violent man, which I would hotly deny.
Dr. Considine, you mentioned a request.
Yes. Simply that Your Honour and the members of the jury be given the opportunity to read this pamphlet for themselves.
Oh, Your Honour, is this necessary? Surely the point is...
Your Honour, this is not a lengthy document, 6 or 7 pages. And despite what has been said, very little polemic. Indeed, it consists mostly of photographs.
Mr. Lorimer, let me see that. Good God Almighty.
No, Lorimer walked right into it. He's young. He'll learn. It didn't really matter what he said in his closing address. All the jury had on their minds was that poor woman, Mrs. Martin, who was too distraught even to appear in court, and those wretched animals in Considine's pamphlet.
Oh, don't tell me about them, David. I don't think I could stomach it.
The jury certainly couldn't. And juries have a sort of herd instinct at times. Anybody that wanted to stop what was going on in that literature of his had to be on the side of the angels. From what I gather, somebody just handed the pamphlet in at Lorimer's office in Edinburgh. He must have thought he'd struck oil, but it backfired on him with a vengeance.
Yes. Do you think the father did it deliberately? You know, got Considine to attend, him specifically, knowing he was an anti-vivisectionist, so that he wouldn't treat the child. How much did Martin know?
He's no fool, that's for sure. And Considine did treat her, after a fashion.
So he was going against his principles, wasn't he? Even calling a doctor in.
He was certainly under pressure from his wife and her mother. Lorimer might have made more of the family's past history. He really needed to enlist the jury's sympathies for the Martin kids, the way Considine did for those poor animals. But whether Martin just caved in and by chance called out the wrong doctor, or whether Considine made a genuine mistake, or
whether the whole thing was a conspiracy. No, it passes belief.
I would like to think so. I really would. But conspiracies are about power, and people do some strange things to get power, and to hang on to it. There was a fair amount of biblical quotation being batted back and forth in court, and I couldn't help thinking about what I suppose is my least favourite Old Testament story.
Abraham and Isaac.
Aye.
It's mine too.
Well, you'll be glad it's all over.
Oh, why, I'll get back to my real trade, opening up cadavers.
David!
Oh, I spoke too soon. I hope that's not D.C. Curran.
Would serve you right.
Dr. Wallace, there's a lady who'd like a word with you. It's a Mrs. Telfer.
Thank you, Mrs. Hamilton. Telfer. That rings a bell. Oh, God, it's the grandmother.
Who?
The Martins' grandmother. Mrs. Martin's mother.
David! Barbara, what's she doing here?
Mrs. Telfer, I'm terribly sorry. I really am, but I don't think there's much I can do.
Dr. Wallace, I don't want to take up your time. I just didn't know who to turn to. It's the other Waynes. There's 2 of them down with the same thing. It's me, John and Sarah. It's diphtheria again. I know it is. I've got Ruth out of that house. Thank God, she's just about dead with fright. I don't know where to go. God forgive me. I had to look up your name in the phone book. The wains are waiting outside. I know diphtheria when I see a doctor. I just couldn't leave her there.
Mrs. Telford, I can't treat the children.
Oh, Doctor.
There's nothing here. If they're ill, they need to go into hospital right away. I'm sorry, but I can't.
But you must know, Dr. Wallace, I heard you in court. You know what's right. I mean, after that Considine, I thought I'd never trust a doctor again. I was just so...
Mrs. Telford, hold on. Wait here a second. Mrs. Hamilton, would you bring Mrs. Telford a cup of tea? Sit there for a minute. I'll see what I can do.
Thank you, Doctor.
Barbara, have you got Dr. Ibson's address or her phone number?
David, what on earth is it?
Oh, yes, I have, but she'll be at the clinic.
David, what's going on? What does she want?
It's the other Martin children. They've contracted diphtheria.
Oh, no.
Oh, my God. Oh, they were bound to. Of course they were.
Do you think she'd treat them? Barbara, it's urgent.
What?
Dr. Ibbotson, would you phone her? I'll get them all into the car. Do you think she'd mind getting involved?
Oh, Dad, absolutely not. I'll phone her right now.
In Hand in Glove, the part of Mr. Lorimer was played by Paul Young, Dr. Wallace by Martin James, and Barbara by Meg Fraser. Mrs. Wallace was played by Jan Moffat, Mrs. Hamilton by Grace Glover, and the Sheriff by Andrew Conlon. Dr. Randolph was played by Alec Heggie, Dr. Considine by Michael Percival Maxwell, and McDade by Alex Harvey. O'Donnell was played by Raymond Short, Martin by Bob Doherty, and Dr. Ibbotson by Louise Beattie. Other parts were played by members of the cast. Technical presentation was by Jim Ross, Lee MacPhail, and Gillian Charles. Hand in Glove was written by Stephen Mulrine and directed in our Edinburgh studios by Hamish Wilson.